If a relative demands, "Why has this happened to my son?" in an NMS station, how would you respond?
Neuroleptic Malignant Syndrome.
Hi everyone, I'm Dr. Clarke MRCPsych and welcome back to Pass the CASC. Today we're covering a station that many candidates worry about due to its emotional charge. Explaining Neuroleptic Malignant Syndrome to a relative of a patient who has suddenly become very unwell. This can feel like a high-pressure, stressful station because you are dealing with a potentially life-threatening reaction and a distressed and angry family member. But the good news is this: with a clear structure, compassionate communication, and a calm explanation, this is actually a very passable station and a great opportunity for you to demonstrate your excellent communication skills. Watch on to learn exactly how I break this station down simply, safely, and confidently, so you too can walk into this station knowing exactly how to secure an excellent pass mark in your real CASC exam.
You are the psychiatry doctor caring for 25-year-old Daniel Harper, who was admitted with a relapse of schizoaffective disorder and restarted on haloperidol. After several days, he developed confusion, rigidity, fever, tachycardia, and a markedly raised CK, leading to a presumptive diagnosis of neuroleptic malignant syndrome. He has been transferred to ICU and is responding to supportive treatment. With Daniel's consent, his mother has come for information. Your task is to explain what happened, what NMS is, and the next steps in his care. Do not stress if you forget any details around NMS when you are under exam pressure. In stations involving a distressed relative, clarity, calmness, and emotional containment are far more important than accurate scientific detail in your explanations and approach. Examiners want to see common sense explanations, safe management steps, visible empathy, and clear reassurance without minimizing risk. Remember, focus on structure and empathy, not on science and jargon. Common pitfalls in this station: overloading with pharmacology, not addressing the relative's emotion, being defensive, failing to mention safeguards for future antipsychotics, and not offering follow-up.
Hello Mrs. Harper, I'm Dr. Clarke and I'm one of the psychiatrists who's been looking after Daniel on the ward. I understand this has been an incredibly upsetting and confusing time, and you've absolutely done the correct thing by coming in today. Before I explain what has happened with Daniel, can I ask, how are you coping at the moment?
Opening with "how are you coping at the moment" gives Mrs. Harper space to express her emotions before they escalate. This often softens her anger, reduces confrontation, and shows the examiner that you prioritize empathy and connection over defensiveness. It also signals that you care about her, not just about explaining the medical facts and trying to justify what has happened. This immediately de-escalates the encounter and sets a calmer, more collaborative tone for the rest of the station. Mrs. Harper may present as angry, frightened, or overwhelmed, and she may direct some of that towards you. She has only been told that Daniel has suffered a reaction to his medication, so she's confused and upset by the lack of information received so far. Before giving any explanation, though, your job is to contain that emotion, let her speak, listen without interrupting, and acknowledge her distress. Once she has finished expressing herself, you can then ground the conversation with calm, empathetic phrases such as,
"I can see how distressed and upset you are, and given everything that's happened, that makes complete sense." Being told only that Daniel had had a reaction to his medication, without any clear answers, must have been really stressful for you. You deserve to understand exactly what has happened and what is being done now to help your son recover.
This emotional containment is essential in CASC. It shows empathy, prevents escalation, and earns marks for good communication and professionalism. Once you've acknowledged her distress and given her space to express concerns, you can gently transition into your explanation of NMS. It's best to signpost this clearly so you have her consent to proceed.
What I'd like to do now is explain exactly what's happened, including the diagnosis, what it means for your son, and what the team are doing to help him right now. Does that sound okay? Please stop me at any moment if you'd like to ask questions or need me to repeat anything.
You've now successfully de-escalated the situation and gained consent to proceed with the explanation part of the station. Keep your explanation simple, calm, and free of any unnecessary jargon. Your goal is to be so clear and steady that Mrs. Harper can follow everything, even while she's feeling extremely distressed.
When Daniel was first admitted, he was really unwell with his schizoaffective disorder. Because he had previously responded well to a medication called haloperidol, we decided to restart that medication at the previous effective dose. Unfortunately, a few days later, he developed a sudden and serious reaction to the medication called Neuroleptic Malignant Syndrome, or NMS for short. This caused him to become confused and agitated, his muscles became very stiff, and his temperature and heart rate rose quickly too. It's a bit like his body went into overdrive, almost like an engine overheating, where everything was running far too fast and far too hot for his body to cope. Blood tests also showed some muscle damage, which fits with this diagnosis. Thankfully, the team recognised these signs immediately and stopped the haloperidol straight away, and arranged for him to be transferred urgently to intensive care, where he is now receiving all of the right treatment and support.
NMS is a rare, unpredictable reaction to antipsychotic medications. It's caused by sudden dopamine blockade, and it leads to muscle rigidity, fever, and autonomic instability. NMS also causes a raised CK on blood tests due to muscle breakdown, and treatment involves immediate stopping of the antipsychotic and supportive care in hospital.
NMS is a rare but serious reaction to antipsychotic medications. It happens in about 1 in 10,000 patients, and unfortunately it's not something that we can ever predict beforehand. Even people who have taken the same medication before can develop this reaction suddenly. It is not an allergic reaction, and it's not because anyone did anything wrong either. It is an unpredictable and dangerous side effect which can occur just out of the blue. NMS is a very serious condition, so as soon as it was suspected, his medication was stopped and he was transferred urgently to the ICU. Since arriving there, he has been given fluids, active cooling, and round-the-clock monitoring, which is exactly the right treatment to help him recover as soon as possible. An important point to emphasise is that early recognition of NMS makes a huge difference to Daniel's recovery.
Is Daniel going to be okay?
The good news is that Daniel is responding really well so far, and the ICU team are very optimistic. I also want to reassure you that most people recover really quickly and completely when NMS is recognised early, as it was in Daniel's case.
Can he take antipsychotics again in the future?
The short answer is yes, but with the caveat of putting some very important safeguards in place. Firstly, I want to assure you that we will not start haloperidol again. Rather, once Daniel is fully recovered and he's had around 2 weeks without any antipsychotic medication at all, we could then consider starting a completely different antipsychotic, but we would do this extremely carefully. To clarify, in order to keep Daniel safe, we would use a different antipsychotic with a completely different chemical structure to haloperidol. Start at a very low dose, increase this dose very gradually and very carefully, all whilst monitoring him very closely, both physically and mentally. This cautious approach has been proven to keep the risk of NMS reoccurring as low as possible.
While Daniel is in ICU, how will I be kept informed, and who should I contact if I have any questions or concerns?
You will receive regular updates about Daniel whilst he's in ICU, both from their department and ours, and you're welcome to contact either of our teams directly too. I'll make sure you have a named contact from our ward who can keep you informed and answer any of your questions.
Remember to reinforce empathy and containment and check understanding to secure those excellent pass marks.
I completely understand that this has all been highly distressing for you, and I'm really sorry that Daniel has had to go through something so unexpected and frightening. Everything you're feeling now makes complete sense.
If time allows, give a clear summary and plan to end the station.
To summarise, Daniel has had a rare reaction to his antipsychotic medication called NMS. He's in ICU receiving exactly the right treatment and round-the-clock care, and he is already showing positive signs of recovery. Once he is transferred back to us, we'll work together with Daniel in order to choose a safer antipsychotic medication, and we'll start this very slowly along with very close monitoring. You'll get regular updates from our team, and I'm more than happy to meet with you again as often as you need. I know today has been overwhelming, and I don't expect you to remember everything we've discussed. If it would help, I can write down the key points for you now to take away, and I'll make sure you have ongoing support and clear communication throughout Daniel's recovery.
The approach demonstrated in this video works really well as it communicates a serious life-threatening reaction both clearly and calmly, shows empathy, compassion and emotional containment throughout, addresses anger and distress without becoming defensive, explains what NMS is, why it happens and how it's treated, demonstrates safe clinical practice around monitoring, prognosis and future treatment planning, provides reassurance, structure and hope, and it offers follow-up, regular updates and written information to support understanding.
When you bring all of these elements together, a clear explanation, steady emotional containment, and simple compassionate language, you show the examiner that you can keep relatives informed and supported even in highly emotional, high-pressure situations.
Here is my roadmap to success in the NMS CASC station. Step 1 is to contain the relative's emotion. Then you should signpost the plan for the rest of the conversation. Next, you need to explain NMS clearly and link it with what happened to the patient in simple language. Step 4 is describing what was done immediately to keep the patient safe. Step 5 is to discuss the patient's prognosis and current progress in the ICU. You should then explain the plan for future antipsychotic treatment and reassure about safety, monitoring and follow-up contacts. Finally, if time allows, you should summarise the conversation and check understanding before closing the consultation.
To consolidate your learning, try explaining NMS to a peer, a friend, or even to yourself in a mirror or on camera right now. If you can closely follow the blueprint in this video, then you too will score exceptionally well in your real CASC exam. If you found this video helpful, then please do subscribe to my channel at Dr. VT Clarke and let me know in the comments which CASC station you'd like me to cover next. I reply to all comments and add all suggestions to my working list.
If you found this video helpful, then please subscribe to my channel. Your support really helps me keep creating and improving these videos. Thanks.